Welcome back. The time is now 6:44 on the clock. Joining me now live from the Flowers Hospital Medical Group is Dr. Nicholas Voss, and thanks so much for being here this morning. We appreciate your time.
Thank you for having me.
Absolutely. Now, you're a neurosurgeon at Dothan Neurospine and Pain Center, correct?
That's right.
Before we get started here, just tell us a little bit about your background, where you received your education and medical training, if you would.
So I grew up in Indiana, and I went to university at Northwestern University in Chicago, and then did my medical training at Tulane University, and then did my residency training in neurosurgery at University of Tennessee, Memphis.
Okay.
So I finished there in 2000, and my first job out of training was in Dothan, and I've been here now 18 years.
I was going to say, you've been here several years. I didn't know I was going to ask. All right, very well, and you obviously like it here. You stay here. It's pretty much home now, I would imagine. Just tell us specifically what types of patients or conditions you treat.
Well, the neurosurgery is sort of a broad area, and it is specialized, but we treat brain and spine conditions as well as peripheral nerve. And so a lot of patients, of course, have neck and back pain, and that seems to be something that the community needs help with, obviously. And so we treat degenerative disc conditions with the neck and the low back. We treat herniated discs. One of our I suppose favorite operations and things that we help people with are pinched nerves, where they have pain down their arm or pain down their leg, and so we can do microscopic, minimally invasive lumbar disc surgeries where we make a small incision and we're able to remove a disc off a pinched nerve and relieve somebody's pain without having them to spend the night in the hospital. So that can be done on an outpatient basis.
Oh, really? Okay.
And the other thing that we're doing, which is fairly new in spine surgery, is we're starting to do artificial discs, which is a technique where instead of treating somebody with a degenerative disc in the neck with a spinal fusion, we can now go in and remove a disc and put in an implant that's called an artificial cervical disc, which allows movement and restores function, and reduces pain, and reduces the chance that that patient might need further surgery on down the road. And so it really is a breakthrough that's proving to be in many ways superior to the traditional fusion techniques. Yeah,
it sounds like it. I've never even heard of that. That's wonderful. And so how can somebody go about making an appointment with you?
I take referrals from other physicians and also self-referrals. So Flowers, anybody who's interested, either a referring physician or patient, can call Flowers Hospital, and our clinic is neuro.spine.pain, and we're located in the Flowers doctor's office building.
Okay, and what floor is that?
On the 4th floor, South Tower.
4th floor, South Tower. All right, well, thank you again for your time. It was a pleasure meeting you. Welcome back anytime. And if you'd like more information, of course, we're going to post this full interview with Dr. Voss, along with his information about his office and his bio, on our website at dothanfirst.com. And stay with us. Wake Up Wiregrass continues after the break.